Salam and hello everyone. Welcome back to the channel. I hope that you are all doing very well. In today's video, I am going to be talking about hair loss in women over 40, specifically female pattern hair loss or androgenic alopecia, which actually occurs in 30 to 40% of women who are experiencing this type of hair loss. Now, this number unfortunately can increase as women get older, maybe 50 to 52% of women who are past the menopause transition, but I don't want to dwell on those numbers. What I really want to do is I want to talk about these 5 reasons, and I want to talk about why it occurs, a little bit of evidence that shows how it is occurring, and then finally, most importantly, is what you can do if you are experiencing female pattern hair loss or hair loss. So let's dive in. The first particular reason is hormonal changes. Now, I've spoken about this before, and many of you are aware that as we get older, we are experiencing a decline in estrogen and progesterone, those very important hormones that regulate a lot of our system. Now, with estrogen and progesterone, we see that there's a decline, and estrogen is really important for hair growth, for the hair growth cycle, the anagen phase, as well as we can see that with this decline, we see an increase in hair shedding. One thing I want to mention is that we don't often talk about testosterone, but testosterone is actually playing a role in this as well. Specifically, dihydrotestosterone, a hormone derived from testosterone, is primarily responsible for the hair loss in females. So you have a lot of hormones at play here, and with that higher androgen activity, that can also miniaturize follicle cells. So it's going to be really important for you to understand this so that when you approach your doctor, talk about hormones and talk about these things, to have some knowledge of what's going on. Now, with the evidence, the Menopause Society or the Menopause Journal in 2019, their research shows that estrogen in general prolongs the growth phase of hair, and reduced estrogen during the menopause phase contributes to female pattern hair loss, which is what I just mentioned. So this menopause phase, many of you might be worried, okay, I don't want to go through menopause. I'm being scared less of all the things that I'm hearing, but do not worry, do not fear. There are things that we can do in advance and just to kind of be proactive before we reach this phase of life. I'll leave a link to those tips for you, but specifically with female pattern hair loss, it's advised to talk to your doctor about treatment, including hormone replacement therapy. I've spoken about this on my channel. If you're a candidate, that might be an option for you, or menopausal replacement therapy. It's called HRT and MHT in some circles. It depends. It's relatively the same thing. As well as talk to your physician or your dermatologist about minoxidil. There are some gentle hair products and shampoos that are out there, but usually I found that evidence states that these things are not as potent, of course, as minoxidil and the hormone replacement therapy. But still, I'd say that consider this as a way to jumpstart your treatment so that you can, feel better about yourself and not be too worried. One of the things I also wanted to mention is that these recommendations are per clinical guidelines. When I went to Chicago and attended the Menopause Society annual conference in 2024, there was a great presentation by a dermatologist who really spoke about not being afraid to go in and see your dermatologist or your physician and getting that treatment, getting that minoxidil, or starting menopausal replacement therapy if you are a candidate. And that's one of the things I want to reiterate here, is to go and seek help if you are feeling like something is going on with hair. You're shedding hair is not growing like it used to, you're feeling something is off. So the lecture was a great lecture. The presentation, it was really short, 1 hour, but it was actually it was more like 20 minutes because he had to share the stage with other presenters. But the information was really good, and I echo what he said. Go in and see your dermatologist if you can. Go in and see someone who is an expert and can help you with this. Now, moving on to the next reason why women will experience hair loss is nutrient deficiencies. Now, this happens because there are multiple deficiencies that we might experience through the menopause transition and even prior to the menopause transition, including iron deficiency, vitamin D deficiency, which I've spoken about many times on my channel. I'll continue to talk about it because I want to be able to get the information across to many of you as best as I can, as well as low zinc and inadequate protein intake. That can all cause issues with growth of the hair as well as increase in shedding. So what the evidence shows is that there were multiple studies that confirm associations between iron deficiency, low ferritin, and telogen effluvium in women. Vitamin D deficiency has also been linked to alopecia. Vitamin D is such an important vitamin. For those of you who don't know, vitamin D is really important for not only immunity, like your immune system, but also for bone health. And now we know it's also important for the growth of your hair and maintaining healthy hair. So if you're not getting enough vitamin D through the sun, for example, I encourage you to consider talking to your local pharmacist or your dietitian or your nurse practitioner about starting a vitamin D supplement. So this vitamin D supplement can be an over-the-counter supplement. They usually come in capsules, vegan capsules, or liquid vitamin D. And think about how much is going to be appropriate for you. So the NIH has stated that for a woman who is between the ages of 20 and 80, for example, you need anywhere from 1,200 to 2,400 international units of vitamin D. So I would say consider vitamin D if you haven't already started vitamin D. Many of you know your levels. Many of you are low in vitamin D. I myself am low in vitamin D, and that's why I take a daily capsule when I remember. I can show you that capsule. I can share that capsule here. I don't have any affiliates with any brand or any supplement, but this is the I'll even just block out the, I don't want to get in trouble here. This is the vitamin D that I take. I take 2,000 units, international units per day. And yeah, it just supports bone, breast, prostate, and immune health. For us, bone, breast, and immune system health. So that's the second thing, is be careful of your nutrient deficiencies. A lot of us are not eating our leafy green vegetables 2 to 3 servings per day. We're not getting in enough protein. Our iron is low. So I do want you to consider supplementation if you are not always able to eat better. And then when you can, try to figure out your diet. Try to figure out how to improve your nutrition, because that's going to be really important for us as we age. Now, the third thing that I want to talk about is stress and cortisol. So chronic stress, we know that it increases cortisol. That can shift follicles into hair shedding phases, telogen effluvium. This is like, if you didn't know this, you probably already know. When you're stressed out, your body reacts in certain ways. You can gain weight, you can break out in hives, or you can break out in acne. Your body just shuts down, and hair loss is one of those reactions. And so for us in midlife, we might be juggling a lot of things, and if we're not able to de-stress, relax, reset, and release that negative energy or that pent-up energy, it doesn't even have to be negative. It just might be we're overworking ourselves. Then that stress can have a negative impact on our body. So the stress of what we're doing may not be negative, but the impact on our body might be negative. So what I would advise all of you women out there who are stressed to do is to really take a step back and to prioritize what's important to you, especially if you know your health is in jeopardy. I would consider monitoring your sleep habits, monitoring how you're living day to day and what you're prioritizing. Monitor, the sleep is really important. I would say the sleep is number one, but also monitor how you react to people, how you react to things, how you react to situations. Don't take too much burden upon your shoulders if you don't have to. I know it's easier said than done because, hey, I've got a lot of responsibility too, and I'm just trying to manage my own responsibilities without getting stressed, without becoming too overburdened with what we have and what we're dealing with. But it really has to start with you and how you want to prioritize yourself in your life, because that stress may not go anywhere, but you have to figure out how to handle it, especially as you are getting older. Now, Again, manage your sleep. The recommendation from the Sleep Society recommends 7 to 9 hours per night, but also be cognizant of your sleep habits and your sleep surroundings. I think it's called sleep hygiene. So of course it's shutting off devices with blue screens way before you enter your bed or are attempting to sleep. Don't eat heavy meals before bedtime. Also, do not drink liquids 1 to 2 hours before going to sleep so that you're not up in the middle of the night using the bathroom. Use blackout curtains, use noise reduction headphones or earplugs. Tell people in your house or your apartment to be quiet if you are sleeping and they're still up. These are some things that you're going to have to really consider if you want to get optimal sleep. And the fourth thing that I want to bring to your attention, it might be a little bit of a sensitive topic, and that is hairstyles and hair care practices. Now, many of us know that we have been braiding, whether it's Brock's braids, cornrows, some of you have sew-ins or locks. We've been doing that for the last 30, 40, 50 years of our lives. And you don't see anything changing in that unless you completely go TWA, teeny weeny afro, or you completely cut your hair and rock a fade or a Caesar. However, many of us might have noticed at this point that with the years of manipulation, we have seen a thinning of our hairline because we have been pulling so much over the last 3-4 decades that our hairline has now, we've ripped the hair out of the follicles and the hairline has receded. And, it's time to stop doing that. It's time to stop, pulling and causing too much tension because of the ponytails and the braids and the cornrows. It's just like, I understand we have no choice but to manipulate our hair so that it can be well groomed. But I would say that if you can, is lessen the tension in any way, shape, or form. If your hair braider is braiding the hair too tight, ask them to go light-handed, not do so much heavy-handed work on your hair, or try and find a hairstyle that is better suited for you. Traction alopecia is the main reason why women of African descent are losing their hair, even in the crown and around the edges. So it's going to be really important, especially for women, to be careful of that and the weakened hairline. Heat styling and also chemical relaxers can also increase breakage. So if you are a woman who tends to relax their hair all the time, is just be careful of the damage that the chemicals can cause to the hair. So in regards to the evidence, I've looked at a dermatology practice that says that traction alopecia is highly preventable. So with regards to the evidence, studies show that traction alopecia is highly prevalent among women who use high tension hairstyles. And that's what I just mentioned. So please be cautious of how you're manipulating your hair into the styles you desire. Now, what to do? Of course, be careful, loosen the hairstyles, reduce heat and chemical treatments, switch to low manipulation protective styles. And again, talk to your braider. I know many of you see professional braiders who braid hair, who have been doing it for years, but they also, they braid too tight, and you don't want to be in a situation where you're continuously braiding your hair too tight, especially around the edges. Okay? Now, the fifth thing that I want to talk to you about is medical condition. Now, fifth on the list are medical conditions and medications. So why this happens? There are many reasons why this can happen, including thyroid disease, autoimmune disorders, and medications such as chemotherapy, anticoagulants, and beta blockers. And I'm sure some of you are aware that this can trigger hair loss. Now, the American Academy of Dermatology lists thyroid dysfunction, lupus, and certain drugs as common causes of midlife hair loss. I'll link an article for you below, but it's going to be important to work with your physician to rule out, number one, any underlying medical issues that you might be experiencing, as well as if the medication is causing hair loss. You should also work with your physician and your team, your healthcare team, to adjust any medications or figure out what to do in addition to those medications. Some of you may not be able to stop the medication you're taking. You need it for a certain reason. So what can you do in addition to that so that you aren't experiencing so much hair loss, or that when you take or when you stop taking the medication, you know what the plan of action is going to be so that you can grow your hair back. For some of you, hair might not be an issue. It may not be even priority in your life right now. There might be more pressing needs so that you know that you can take care of yourself and your life, and then you'll grow your hair later. And I understand that too. I hope I'm making sense in what I'm saying, that the hair is not priority. Saving your life is a priority. And I get that for some of you. But once you're done and once you're healthy, because I know you will be, is to then focus on finding a solution for growing your hair back if that's what you desire. Now, please be aware that this is a short video and I did not dive into detail on the medications, including the dosaging and the side effects and the cautions and, who should stay away from the medications. I can do that in a later video, but right now I just wanted to talk about some of the causes and reasons why we are experiencing hair loss and some of the things we need to do if it is in our control to prevent hair loss. So I want you to leave a comment below, please, and let me know what you have been doing to boost boost your hair growth. It could be something in terms of you're using a new shampoo, or you're trying a new diet, or you're juicing differently, or you're exercising differently, or you've tried a new medication that your doctor prescribed. Let me know in the comments what you've tried and if you're seeing any results. Hopefully you are, and I will be working on more content related to this because I know it's a very sensitive but really important topic. So please make sure that you always check in with your provider and seek your provider's advice if you are experiencing any type of medical ailment and you are unsure about it. And I do thank you for watching, and I shall see you in the next video. Take care. Bye.